Hi, Dave from Informed American here, talking to you about this crazy story out of Orlando. A man who died in a motorcycle accident counted as a COVID-19 death. Unbelievable. And the question here is this a wider problem? So we're going to get into this today a little bit here. We got a story out of Fox 35 from Orlando. A person who died, and we talked about that. And so the Fox 35 asked the county medical examiner or the health officer what the deal with this is, because the man clearly died in a motorcycle crash. Yes, he apparently had tested positive for COVID-19, but that doesn't mean that that it's a COVID-19 death. If I have COVID-19 and I fall off a roof of a building, that's not a COVID-19 death, is it? And it's crazy too. You get this crazy quote here from the health officer here. Says, being asked by Fox 35, he's like, I don't think so. I have to double check. If it's not really clear. Obviously, the man died in a motorcycle, but listen to this. But if you could actually argue that it could have been COVID-19 that caused him to crash, I don't know the conclusion of that one. What he had to cough or something because of something in his lungs, and that made him wobble the motorcycle and die. I mean, it's just absurd. There's no way. There's no way this is a COVID-19 death. And this is just one of many cases. By the way, and just a little story update. After the attention here of Fox 35 on the Orange County health official there in Florida, they finally removed that death as a COVID death and just as an accident, motorcycle accident, however they do these. But point is, this is not the only incident of this kind of a thing, and the question really here is, how widespread is it? We've got a story here from out of Real Healthy News. Basically, the title here of this video: "Down for the count. Are officials lying to make COVID seem worse?" It says recently, the San Antonio Health Department in Texas was called out for adding almost 3,500 cases to its positive count of COVID-19 infections in a place where patients were never tested. By the way, I haven't seen much verification on this outside of just people talking about this on Twitter. But some people have said that they got in line at these testing facilities and they just to go get tested for COVID. And I guess they figured, well, the line is like, I'm here for an hour. It looks like I'm going to be here another hour or two. They get out of line. And then later on, they get an email saying, oh, you tested positive for COVID-19. Really weird there, right? Because I guess all they did was register, and whoever the testing facility had their name, email address, and all that, so then to get in line, didn't even get the test, and then they get an email saying that they tested positive. So something fishy is going on there, and this is not the only one. We got here in Pennsylvania had been reporting probable deaths from COVID-19 as part of a final fatality count. The number doubled the number of reported daily deaths in one day. Then after some complaints, they had to remove 200 deaths. There was a case in New Jersey in nursing homes. Federal data showed 753 deaths in a nursing home from COVID-19, one nursing home in New Jersey, but only 16 people actually died. So they had to take those back. They said 396 corona-related deaths, but there were only actually 28. And then the question it becomes of, as we talked about with the motorcycle accident, if you have a heart condition, something like that, if you have both a problem, an underlying health or serious health issue, and a positive COVID-19 death, and then you die, how do you classify it? And it seems like in the beginning they're just calling everything COVID. Even I guess if you've got something really awful like cancer, or if you have a heart attack, how do you tease that out? And it's clearly they've been counting these as COVID deaths. And this is a quote here by Dr. Deborah Burke suggesting that the number of coronavirus cases could be overcounted by up to 25%. Well, the question is, for all of you here, why? Why is this happening? And there's one. It looks like there's really two possible reasons, and maybe both working together. It says, as a result of the rules of the CARES Act, Medicare pays hospitals a 20% higher rate for COVID-19 patients. Also, the November election that's certainly coming up. We've heard the hysteria about my home state of Florida, the state of COVID-19, and certainly cases are up, deaths are up. But then when you go and look back to say, New York, it's not even close. And why all the attention to, say, a battleground state? Well, we know why, because of the November election. This unfortunately has become political, and anything that can be done to weaken the president's re-election chances will be done. You can certainly count on that as we march through to November. So that's what I think. I'd love to know what all of you think about this situation, of the overcounting of COVID cases, fatalities. Why do you think that is the case? Love to know. Go ahead and hit me in the comment section below. Thanks so much for watching, and we'll catch you in the next video.